Hello, everyone. I'll give folks just some time to join this webinar, and we'll go ahead and begin in about a minute. All right, let's go ahead and begin. Good afternoon, everyone. Welcome to the fifth and final installment of the 2022 Surveillance, Treatment, and Well Testing Approaches for Safe Groundwater and Private Wells webinar series. Thank you for joining us. My name is Reem Tariq, and I'm a Senior Project Coordinator at the National Environmental Health Association. I'm also serving as the lead administrator for the Private Water Network. Under the guidance of the Rural Community Assistance Partnership, the National Environmental Health Association is hosting a 5-part webinar series on private well and groundwater monitoring and surveillance methodologies, emerging treatment technologies, and appropriate risk communication strategies on private well testing. This webinar series provides a much needed, easy to access information and training on domestic well water quality and safety at no cost to environmental health professionals. Before we get into the details of this webinar, I would like to address a few things about the private water network, since the webinar series topic area relates to private wells. If you are not a member of the network and are curious about learning what the network has to offer, then let me inform you that the network is a virtual community of public health professionals and safety workers that work with private drinking water systems. The network was launched by NIHA in partnership with CDC and NNPHI. The mission of the private water network is to build a sustainable community for those working to support private water programs, to connect with their peers, to share experiences, insights, and resources, and to gain access to timely and relevant guidance for existing and emerging issues. We also work towards building the capacity to do the work more effectively and efficiently in order to protect the public's health from contaminants in private water sources. Membership to the private water network offers access to a virtual community platform that includes plenty features such as a discussion forum, a directory. Also, this is a free resource for anyone who would like to join. Now on to today's webinar. The title of today's discussion is New Mexico Department of Health's approaches to estimating private wells, private well users, and risk estimations. In this presentation, New Mexico Department of Health will describe their work on estimating the number of private domestic wells and private domestic well users in the state of New Mexico. The speaker will also describe their approaches to estimating risk from regional contaminants within the area of study. The speaker will also share insights on determining private well testing distribution patterns within the area of study. Our speaker for today is Rose Galbraith. Rose has been with the New Mexico Department of Health for 7 years and with the Environmental Health Epidemiology Bureau for 5 years, where she specializes in drinking water epidemiology and issues related to groundwater and health. She works to increase New Mexico Department of Health's groundwater and drinking water focused environmental health program capacity through epidemiology, health education, and programs and activities for New Mexicans and professionals working in the areas of water quality and health. She received her bachelor's degrees in environmental science and microbiology from Oregon State University and a master's of public health from University of New Mexico. Prior to receiving her MPH, she worked in environmental chemistry and molecular biology. Some housekeeping rules before we get into our webinar for today. Please note that the session is being recorded. This recording will be uploaded onto the Private Water Network Resource Library, as well as the NIHA Learning Management System. We are hoping to have a fairly interactive Q&A session. So I encourage you to drop your questions at any point during this presentation in the Q&A box. You could also use the chat box, or towards the end of this discussion, you could unmute yourself, raise your hand, and you could share your question out loud. We will also be sharing links to any resources that are mentioned in the session that are available to the public. Those will be included in a follow-up email, as well as on the NIHA's learning management system. At the conclusion of the session, you will be directed to a short evaluation survey and an annual evaluation survey for the network as well. Please complete the brief survey because it does help us in planning for future webinars. And with that, I will turn it over to Rose.
All right, thank you, Reem. Give me just 1 second to share my screen here. Okay, can you see everything all right?
Yep, looks great.
Excellent. Hello, everybody. As Reem mentioned, my name is Rose Galbraith. I'm with the New Mexico Department of Health, and I'm going to talk about estimating private well users and private well using populations and some risk estimation approaches. So to give a little background about our state, if you don't know where we are in the US, I've provided a map here. You'd be surprised. A little bit about us. We are the 5th largest state, and only a very small percentage of our land area is surface water. So that means groundwater, really big deal. And we have a pretty small population, just about 2 million, and roughly half of that is kind of centered in our larger metropolitan areas. And then we are, of course, diverse culturally, but also geologically and geographically. So this audience likely does know what a private domestic well is, but I just want to emphasize that for many people in our state, it is the only option for drinking water. And of course, like a lot of states in New Mexico, our water quality is not regulated for private wells. So what do we know about private well owners in the state? Well, they're in all 33 of our counties and all kinds of environments and geographies. They're in small communities, large communities, rural areas. There's a range of economic backgrounds for well owners. Some well owners in the state their families have used wells for generations, and some, of course, have never used a well before, never owned a well before. So based on the work that I'm going to talk about today, at least 13% of the population of the state uses private wells, but definitely this is an underestimate. Potentially this is an underserved population because unlike people who rely on community water systems, there isn't sort of an infrastructure in place to support them. For example, regular water quality testing. And the private well owner, of course, is the primary person responsible for everything to do with the well. And of course, based on our work in the state and those done by others, there's a whole range in risk perceptions of well owners, especially in terms of water quality. So what do we know about potential risks in the state? We know that there are some naturally occurring groundwater constituents. I've listed some of them here. Some that have some potentially significant health implications, and some, of course, that are more nuisance kind of constituents, kind of secondary constituents. And of course, fluoride can go either way. And what do we know about other contaminant sources in the state? Well, I think like most states, or probably all states, we have incomplete data to really get the full picture, but we know that there are a lot of potential sources of concern that are common concerns probably across all states. So what is our approach to better serve this population? How do we, as a Department of Health, estimate the number of wells and the number of people relying on them? And how do we start thinking about the potential risks, exposures, and what do we know about health protective behaviors? And for this, I'm going to focus on testing. So in New Mexico, the Department of Health is centralized, so our jurisdiction is statewide. And we wanted to have estimates at a smaller geography and decided to focus on county because we do have some counties that have less than 20 known permitted wells. So what geolocated data sources do we have available in the state? So basically there's two. There's the well construction permits, which come from a partner state agency and are only for well construction, have nothing to do with water quality. But they are updated regularly and they are easily available. So there's just over 135,000 of these records. And then internally in the Department of Health, we maintain a private well water quality inventory. And all of our data sources are from government events or programs. And this is from federal to state to local level. And all of these are compiled and updated as is feasible, ideally annually, not so much recently. And then they are geocoded internally. So we have just under 26,000 records that are currently geocoded. So the method that I used was to try to link these two data sources by proximity, even to identify if they were the same well, and then to find out if we had any unique wells in the water quality inventory that weren't in the permit data set. And likely this is true because we know a lot of people use wells that aren't permitted. And then these were spatially joined to county. So the result is, as I mentioned, 135,000 plus permitted wells. And then there were just in the range of 21,000 unique wells in our water quality data set. So best estimate is just under 157,000 wells in the state. And likely, given the data limitations, this is an underestimate. And this just shows what that looks like by county. And of course, right in the middle of the state, those are our population centers. So highest number of wells, we expect that. And then the lowest number of wells by county circled in blue, those are more rural areas. And again, we expect that. And then the kind of mid-range counties for number of wells are circled in brown. And these are likely the number of wells is maybe driven by the economic activities in the county. For example, a lot of agricultural activities. So how do we estimate the number of people using wells? So I will say that a former colleague really led this part of the project. So if there's questions on this after, I will do my best to answer them. So the data sources for this, we focused on public water data, and I will get into that in a minute as to why. And it comes from our partner agency, the New Mexico Environment Department, and it's processed internally by the Department of Health. So it's the Safe Drinking Water Information System data, SIDWIS, and specifically number of people served per system. And then we were able to find a water system boundary file, which came from another state agency as part of a one-time pilot project they had to develop this kind of data. And then we use population data, which of course comes from the census and again was processed internally. And we're looking at county level here. And then my former colleagues sourced a population density estimate data source as well. So what was the method? Well, take the county population, subtract the number of water system users by county, and what's left should be your well users. So to do this, had to assign public water systems to county, and there are some that cross counties. So for those, if the extension into the second county had really low or no population density, then it was assigned to the primary county. If there was kind of equal population distribution, then it was the number of people served by system was split proportionally. So the counties here with the check marks have no systems that cross boundaries. So good to go there. And then there were under 10 systems that had county splits. So then these were looked at a little more closely and using the population density, as I mentioned, to proportionally assign the number of systems. So there were just a few systems that were split here between counties. And overall, this was 0.8% of all the public water systems. So it was a really small number of systems. So what are the results? Well, it turns out this is not a great method right now in the state, given the data that we currently have available. Many counties had a negative estimate for private wells. And this is because some water system estimates were larger than the overall county total population. So we dug into this a little bit, and it looks like there's not a standard way that systems estimate the number of people served. The most frequent it looked like is using the number of connections and then estimated household size. And this doesn't seem to account for inactive connections, so it's an overestimate of the number of users. So this table, I know, is probably hard to read. Really just wanted to point out the counties highlighted in yellow. These are all the counties where the water system service population was greater than the county population. So you can see there's a lot of yellow counties here. So now to talk about estimating risk and health protective behaviors. So what do we know about private well testing by county? Pardon, oops. Okay. So the data sources, again, are internal private wells water quality inventory. And this, I've already mentioned, it comes from all governmental sources. So this pie chart shows by agency type, and then the gray is the wells using the number of permitted wells, those that we don't know any water quality on. And then the majority of this data comes from a collaboration with the New Mexico Environment Department and the Department of Health, and we provide field water testing events in different locations throughout the state every year. And so these are field tests. So the water quality is not the best, or the test quality is not the best, but it's the best data that we have available. And then all these sources are combined and aggregated to county. So as I mentioned multiple times, these are all governmental data sources. So it's definitely an underestimate of actual testing because this doesn't include any sort of private laboratory testing. So the results estimated about 20% of wells statewide have been tested for anything. And this ranges from 4.5% in one of our very rural counties to almost 60% in one of our more small metropolitan mixed urban rural counties, with an average of 21%. And 3 counties had greater than 100%, so definitely something going on there. Possible explanations is an undercount of permitted wells in the county. Maybe higher testing availability, maybe higher testing participation in our events, maybe something else. There isn't really a great way to get at what's going on here. And this is just a map that shows that. So the red is all the counties that are over 100%, so kind of put those aside. But again, the northwest portion of the state had the highest that was below 100%. And historically, this is an area where we've had really great participation. And then in the southwest is a very rural county, and so we don't expect to have a lot of testing. So what do we know about groundwater drinking water exposures in the state? So again, our best source of data is the water quality that we do know. So our water quality inventory. And then also, what do we know about the geology in the state? So the method approach really was driven by data availability. Of course, there's lots of different ways to think about risk for this population, but really the best data we had is water quality. So risk estimates are kind of being inferred through what we know about the water quality. So our water quality inventory is summarized by key constituents listed here, and really why these constituents, because that's what we have data on. And then they are summarized by county, and then I used a very simple modeling approach, inverse distance weighted. So what are the results? So I'm just going to focus on arsenic here for this presentation. So again, I know this is a big table and probably hard to see. This is a summary of arsenic by county. So highlighted in yellow are the counties with the highest percent of tests that are above the MCL of 0.01 milligrams per liter. So the highest, little caveat here, there were only 9 tests in this county. The second highest, much larger number of tests, about 50% of them were above the MCL. And this is an area where we do know that there's arsenic. It's on the Rio Grande Valley, and we know that that's a potential area of concern for arsenic in the state. And then the blue here is percent tests above MCL that were 0. And there's a number of them, but again, some of them are very small numbers of tests. So this is what the interpolated map looks like. And you can see there is definitely an area in the state that shows higher arsenic. And again, I mentioned that's along the Rio Grande River Valley, and we know this is an area of concern. So I wanted to take a very preliminary approach to looking at the geologic hazards. I am not a hydrologist, I'm an epidemiologist. So this was a very high level approach to begin to examine this. And hopefully in the future, we can take a more in-depth look at this. So well locations were joined to a simple geology layer and summarized, and then specifically looked at wells where we know anything about the arsenic. So any well that had detected arsenic in our inventory, and then also summarized by wells that had arsenic above the MCL. So this is what we found. And again, a very kind of high level geologic correlation. And specifically looking at the arsenic, we do see that there is a correlation with geologic type and where we see the wells with the higher arsenic. And this is just what it looks like mapped out. So how is the Department of Health going to use the results from all these approaches? We're going to continue our drinking water focused epidemiology, which is trying to identify the populations at risk, of course, and it will continue to inform our response efforts, especially if there's some sort of particular contamination event. And it will continue to inform our intervention planning, development, outreach, where we have testing events, what kind of materials we provide, things like that. And of course, partnership building, what partners can help us better reach this population. And it is helping to identify a population likely to be disproportionately impacted, for example, by climate change effects on drinking water. So I've mentioned some of these going along, but what are some of the data limitations and what are the steps we're going to take in the future? So we don't have a great way to link what we know about well water quality and well location. And this work within this project is kind of a first step towards that. And something that would greatly aid this work is an individual well identifier. And this is something the state has been working on for a number of years. And we are slowly moving towards this goal. And this is partnership with one of our other state agencies. And there is legislation requiring unique identifiers and an ID tag for new wells as of 2017. So we're slowly moving in that direction. Private well testing data. I mentioned we don't have any commercial lab data, and this is a future goal. We've had preliminary conversations, and there's a lot of barriers. In our state, any water testing done outside of the events I described is done at a private lab, not through the state lab. So there's really a lot of barriers in trying to get that data. And then taking a closer look at regional contaminant assessments. One area that we're trying to focus on is septic systems. We know they are a potential important source of groundwater contamination. So we are currently in the data gathering phase of that and working with our partners who permit septic systems. Of course, we want to take a better community-focused assessment approach. And again, this is kind of a future goal, mostly limited by not having the staff capacity to do all of these things, and focusing on emerging contaminants. And of course, data is a big limitation. We do have some very kind of site-specific information on that. And we need better water system boundary estimates. What we had available was kind of a one-time snapshot. It's not currently being updated. So this is something, again, the state and other partners have been working on for a long time, and we are slowly as a state moving towards this goal. So I would like to thank the National Environmental Health Association and the Center for and the CDC, of course, for supporting this work, and also for the Department of Health, my Bureau's leadership, and also my program partners in the Environmental Public Health Tracking Program. So that is all I have. Reem, I have not been able to monitor if there's questions coming through while I was talking.
Great. No worries, Rose. Thank you so much. Wonderful presentation. Just as a reminder to the audience, you can drop your questions in the Q&A box. You can also drop them in the chat box if that's more convenient. If you'd like to ask a series of questions out loud, all you have to do is raise your hand and I'll go ahead and unmute you. Okay. I don't think we've received any questions so far. I did see a series of questions that came in.
Okay, yeah, go ahead.
Yeah, I did see a series of questions come in through the chat box about CEs. I've dropped the link in there. And I do see a question for you, Rose. Brittany asks, what are the barriers associated with using commercial labs to test private wells? Is it a lack of funding?
That's one possible barrier, but more it's privacy concerns about the labs being willing to share that data with us.
Okay.
And so really, you know, we need to build those relationships and that trust. And so from that perspective, yes, it is kind of a funding and staffing problem because, you know, of course, that is really a sustained process to build those relationships.
Excellent. Thanks, Rose. We've got another question from Gabriel. She asks, question on the mention of lack of surface water in New Mexico. Do people use rainwater or recycled septic?
Well, you know, I don't personally have the data to answer that question. I do know that at the county level, there are some current conservation programs to encourage people to collect rainwater. How many folks are using that as a drinking water source? I really don't have the ability to answer that. And I'm sorry, what was the second part of that question?
I think you covered it. Rainwater or recycled septic?
Oh, recycled septic.
Mm-hmm.
Well, I'm not quite sure what's meant by that. I mean, a lot of well owners do have septic systems in place. But again, yeah, I think we just don't have a good handle on that.
Okay. We've got a question. Did you count tourists or seasonal visitors as you were doing your analysis?
So this would be for the population estimates, I presume is what you're asking about. No, transitory systems were not included in that. And we did also remove military bases.
Excellent, thank you. Stephanie asks about sampling for uranium. Is that something that was
Oh,
considered?
yes. Yes. So we do have some uranium data in our inventory. A lot of that comes from our prior biomass that we have in the Department of Health. And that is something that I considered looking at, but there didn't seem to be really great data available in terms of areas of potential exposure. I mean, we know there are specific sites. Data availability was really the main barrier to that.
Rose, I think we lost you towards the tail end of your response. Your audio, I'm not sure if this is just for me, but it's coming in a bit strange. Could you please repeat that last part?
Yeah.
Is it just me? Is it anybody else struggling with Rose's audio? You could drop a response in the chat. Yes, it looks like everyone else is experiencing that too. Rose, if you do want to call in via phone, feel free to do that. Rose, are you there?
Yes, I will call in by phone. Give me 1 second.
Okay. And in the meantime, I'm not sure. There were a couple of questions in the Q&A box, but I seem to have lost them. I'm not sure what happened. Anybody who has not had a question addressed, do you mind please putting that in the Q&A box again? And I apologize for these tech issues. I'm not quite sure what's happening. It looks like some other folks are struggling as well. Leonard, I do
Okay,
recall
I'm on
seeing
by
a...
phone. Can you hear me?
Yes, it's perfect audio.
Okay. Sorry about that. My internet is not so great at home, and we actually have snow in New Mexico today, so that might be contributing. So I believe there was a question about uranium, and that is something that I did consider focusing on, but there just wasn't the data at this point.
Okay.
And were there other questions? I may have missed that.
Yeah, I do recall seeing at least 2 questions in the Q&A box, but for some reason they just disappeared. So I don't know if everybody is experiencing Zoom issues and it's just not you, Rose, because I definitely lost some questions from the Q&A box. They just disappeared, which I've never experienced. I know, Leonard, you dropped in a question for a fact because I saw your name up there. So if you do want to put your question back in there, that would be great. And I see Wendy is asking, is there uranium naturally occurring or otherwise?
Yes, it is naturally occurring. And we do know of specific areas in the site that are in the state that are impacted by legacy mining issues.
Okay, Leonard has asked, did your study include contacting well owners who had arsenic levels above the MCL?
No, that's a bit beyond the scope of this particular project. We do, within my program and through the tracking program, we do provide information for well owners about arsenic and health protective behaviors they can take in general for private wells. And during the testing events, of course, there are can be interactions with well owners to answer their specific questions. But did we reach out to each of these well owners? No, that's beyond the capacity of the program.
Okay, let's move on to the next question. Someone's asking, Rose, you said in counting the number of people connected to private well systems together with census data and trouble with not getting good numbers. Were there any thoughts on, rather, I believe this person, yeah, this, sorry. Were there any thoughts on, let me see if I can piece this together. Sorry, the rest of my question was to get better numbers of people living in households, some sort of data work with flow. Were there any thoughts on getting better numbers of people living in households with data work with flow? Does that make sense, Rose? I may have botched that question.
I'm not sure, but I think the question is asking if there were any thoughts on how to better approach this. So we did reach out to our data steward partners, and they basically told us that this probably isn't going to get any better in the future. And we reached out to a few of the system operators, and how they collect this information is all over the place. How often it's updated is all over the place. And it seems like it's just not a priority. Of course, they're all, resource strapped. So what another approach could be, I don't know. If anybody has any suggestions, methods used by other states, please pass them my way. And I will put my email here in the chat. So I hope that answered your question.
Excellent. Thank you, Rose. Thanks for piecing that together for me. All right. Let's see if there are any other questions that trickle in. At this point, I believe we've addressed all the questions in the chat box, the Q&A box, and I don't think anybody has raised their hand. All right, I'll give it a minute.
All right, well, thank you everybody for attending, and thank you for your questions.
Absolutely agreed. And I did see another question come in regarding CEs. So I'm just going to drop a link right here for everybody. If you are interested in getting CEs for this particular webinar, you can use the link in the chat box. The link will take you to a form where you can fill it out, and those hours do go towards any credential, specifically the REHS. But if you would prefer to have some kind of a certificate, we do those on needs basis. So if you'd like that, I did see some requests come in via chat regarding a certificate. If you have not reached out to me and would like to, you can always email me. I'm going to drop my email in the chat as well. If you would like a certificate that notes the fact that you participated in this webinar. So go ahead and email me if you'd like that. I've dropped my email in the chat box, and looks like there are no other questions. Rose, I want to thank you for taking the time out for putting together an insightful presentation for us. I want to thank all the attendees for asking great questions and listening in. Just be mindful of the fact that when you do X out of this webinar, there will be a survey that will pop up. Please do take that survey because it does help us in planning for future webinars. I'm also dropping 2 additional links in the chat box here. One is for the Private Water Network online community that I referred to towards the beginning of this webinar. And the other one is a private water network survey. We do accept survey responses from non-members. We are interested in learning about how we could possibly expand further and what non-members would like to see as part of the network. So if you are interested or curious about the network and you want to offer some kind of feedback, please do take that survey, because there will be an opportunity for you to share some ideas. And with that, I want to thank Rose again and thank you all for joining. And uh, you have my email. If you do have any questions about CEs or certificates, feel free to reach out to me. And with that, I thank you.